a back spasm, for instance, or even, sciatica. In that case, typically what I've recommended to patients are either tinctures, so under the tongue, or edibles that they take on a regular basis, not every day. This is not a medication that has to be taken on an everyday basis, again, because it gets stored in the fat cells in the body.
Okay.
But on a regular basis, that then helps to overall reduce the levels of pain, okay, impacting the patient's quality of life, and then also minimizes the episodes of breakthrough pain that they may experience as well.
Okay. Now, is there an addiction component to CBD like opiates have or anything like that?
Yeah, so the best way to talk about this is in terms of chemicals, right? So let's talk about it in terms of the most prevalent chemicals in the cannabis family of plants, which are CBD and THC.
Okay.
So with CBD, based on medical studies and based on what I've seen clinically, there's little to no potential for addiction.
Okay.
With THC, based on medical studies, as I haven't really seen this clinically because my patients are using these products in moderation, but medical studies have shown in heavy users a potential for addiction. So heavy use is where you're aiming for maximal dose, maximal frequency, whereas from a medical standpoint, I believe in minimal effective dose and minimal effective frequency.
Okay. So finally, let's talk about side effects and who should not be taking CBD oils.
Yep.
So
yeah.
Go ahead. Sorry.
So let's do this again, chemical by chemical, right? With CBD, the most common side effect when patients take too much is that they may wake up feeling groggy or tired, similar to the effect that patients may have when they take Benadryl or any sort of over-the-counter sleeping aid. That's the most common side effect there. With excess amounts of THC, okay, some common side effects include heart racing, so palpitations, dizziness, anxiety, to the point where the patient may experience paranoia. And if they've taken a severely high dose of THC, that's when hallucinations come into the picture.
Okay. And what about populations who should not be taking CBD?
Sure. So specifically with CBD, what the research has shown is that when CBD is combined with a medication that has the potential to cause hepatocellular injury, right? So hepato means liver, cellular means cell. So we're talking about liver cells here.
Okay.
So any medication that has the potential to cause liver injury, when combined with CBD, it increases its potential to cause liver injury. So the research, this research was specifically done on patients taking valproic acid, which is an anti-seizure medication, otherwise known as valproate.
Mm-hmm.
So what they found was that when these patients were administered both together, their liver enzyme levels went up. However, when they lowered either the CBD or the valproic acid, the liver enzyme levels went back down to normal. So basically, anybody on a medication that has the potential to cause hepatocellular injury, if you're taking CBD products, you should be closely monitored under the care of a physician. Then any woman who is planning on becoming pregnant, who is pregnant, or who is breastfeeding, I err on the side of caution and recommend that they not use cannabinoid products, including CBD. And this is because there is research, not the best of research, but still research that points to the fact that, there's potential there of causing low birth weight as well as premature labor and delivery. And if you are a breastfeeding mother, then there is research, there's data that shows that these cannabinoids can be passed on to a growing infant. And we don't know what the effect can be on a growing infant, with these cannabinoids. So I tend to err on the side of caution and tell these patients not to use cannabinoids in general.
Okay. Well, I've learned a ton, so I'm hoping everyone else did as well. So, just again, here is the book CBD Oil Solution. It's actually a lot of information, and there's some recipes in the back as well. And you have a YouTube channel as well, correct?
I do. I always like to continue to answer questions because there's such a dearth of information, first of all. And then the other thing is that, Dr. Google tends to spread a lot of misinformation out there, especially about cannabinoids.
Okay.
So there's a library of information. And, I'll give you the link to my YouTube channel to share.
Okay.
And I answer all sorts of questions based on medical condition, based on, what to look for when it comes to the quality of CBD products, whether you should be using hemp-based CBD products, or whether you should be using marijuana-based products for your, specific condition. So all sorts of information that I go over there.
Wonderful. And I bought this on Amazon, and I'm sure everyone else can as well. And you have a website as well?
I do. So website is docpatels.com. So there's tons of information there as well.
Wonderful. So, please comment if you like, what you saw. Go ahead and click like and subscribe. And I wanted to thank Dr. Rachna Patel once again for coming on our podcast. Thank you very much, and we'll see you next time.